Good evening, everyone. Buenas noches a todos. Welcome, bienvenidos, to the 2021 National Hispanic Council on Aging's virtual awards ceremony and fundraising event, United for Equity. For over 50 years, NHCOA has served as the nation's premier organization focused on improving the lives of Hispanic older adults, their familias, and caregivers. This year is no different. Today's event creates a safe space for us to celebrate our shared commitment to Hispanic families and aging issues, as well as to acknowledge the trailblazers who are paving the way in these areas. This event is also NHCOA's largest fundraising event of the year. Language, culture, familia, family-centric, these values characterize our growing Hispanic aging population, which will represent 1 in 5 older Americans by 2050. While the growth of this population is exciting, our Hispanic elders face a barrage of challenges that stem from lifetimes of discrimination, leading to immense complications regarding their health, their economic security, and more. This, unfortunately, hinders their ability to enjoy healthy and meaningful lives in their golden years. In a time where being healthy is of the utmost importance, the health of Hispanic seniors is a major concern and roadblock to successfully aging. The theme for this year's award ceremony is United for Equity. For over 2 years, the COVID-19 pandemic has disproportionately affected underserved communities, minorities, and vulnerable populations such as Hispanic older adults. The pandemic has dealt a massive blow to healthcare and its accessibility, an issue that these populations have been fighting for years. As the pandemic has progressed over this past year, health inequities have broadened, and many more have been uncovered and exacerbated. Since the beginning of the pandemic, the National Hispanic Council on Aging has been creating and executing innovative ways to help Hispanic older adults, their caregivers, and their familias. Getting as many people as we can vaccinated is now a tremendous priority. To address these needs and help to get vaccines to the populations that need them the most, NHCOA launched a multilingual COVID-19 resource center that is assisting Hispanic communities and older adults to get vaccinated. By calling the helpline, people will receive up-to-date, scientifically based information on vaccines, on current safety guidelines, and facts about the virus in Spanish, English, and Portuguese. In addition, we continue to inform and educate our community about COVID-19 and its vaccines through our Promotoras de Salud network, health fairs, as well as social media platforms, among other means of communication. NHCOA is committed to advocating for policies that protect our Hispanic older adults, their families, and caregivers around issues like paid leave, affordable housing, caregiving legislations and resources, vaccine access, protecting Social Security, and protecting the Medicare Part D program that for many years has provided affordable coverage to beneficiaries, among many other policies that NHCOA advocates for on a daily basis. Also, through a variety of health programs that NHCOA offers, it provides educational materials and events that highlights COVID-19 and its vaccines, general vaccines, HIV, diabetes, Alzheimer's disease, the importance of health research, and many other topics of importance for our comunidad. Amid the challenges that our community faces, NHCOA is committed to building a stronger America. Of course, we cannot do it alone. By working together, juntos, we can all bring that change for Hispanic older adults and other diverse populations to be able to age securely, with dignity, greater self-sufficiency, and in the best possible health. As part of today's event, we celebrate Hispanic heritage by sharing in the beauty of our culture, our traditions, and applauding our accomplishments. We will have the opportunity to listen to a variety of Latino music performed by Douglas Lira Band, along with salsa and merengue dance performances from Elegant Dancing. Thank you all for being here, for supporting the important work of NHCOA. As you know, tonight we will be having our annual award ceremony giveaway, where a lucky viewer will win a brand new Apple Watch. We want to remind you that this is an international giveaway, so everyone can participate no matter where you are watching us from. Stay tuned, amigos, so you can participate. Before we begin celebration, on behalf of the National Hispanic Council on Aging, we want to acknowledge that none of this would be possible without the generous sponsors of today's awards celebration. Our event sponsors include Lyft, Lilly, Verizon, AARP, Herbalife, Novo Nordisk, AstraZeneca, Amgen, Compassion and Choices, Abbott, and the Alzheimer's Association.
Good evening. I'm delighted to welcome you to our annual awards ceremony. This year, it gives me great honor to focus our attention on equity, an area that many of us have been concerned about for a long time. At NHCOA, we are strengthening our efforts to ensure we are looking at our work in the areas of economic security, health, and housing from an equity lens. Racial and ethnic minority groups have historically not had broad opportunities for economic security, physical and emotional health. And these inequities have increased the risk of getting sick and dying from COVID-19 and other illnesses. That is why today we recommit our efforts, energy, and passion to ensure equitable access for all. We stand united for equity to address systemic and structural barriers that are keeping many in our communities from Aging Well. As we prepare for a new year, we look forward to the implementation of transformational policies across our nation. The new and historic infrastructure legislation passed will serve to allow older adults to age in place in the comfort of their homes, in their communities, and with their families. It will also create better paying jobs for caregivers. And we want to pause for a minute to express our gratitude for all the contributions of luminaries that have made important strides to advancing equity, especially those being recognized this year. And while we have made important progress, much more remains to get done. And the moment is now to come together to forge a brighter future. We have prepared a beautiful virtual event to celebrate luminaries who help older adults have a better life. And you will join us from the comfort of your home. This evening, you will have the chance to meet the awardees, get a chance to win a prize, enjoy some fantastic performances, and have the opportunity to help us improve the lives of older adults and their caregivers. Lastly, I'd like to thank you for supporting our work. Special thanks to our board of directors, our board chair, Cindy Padilla, and our business advisory council. We are grateful to all our sponsors, grassroots leaders, caregivers, and older adults across the country. And finally, I'd like to also wish you a happy and peaceful holiday season. Please enjoy the evening.
Good evening, everyone, and thank you, Maria. Welcome to the National Hispanic Council on Aging's 2021 Virtual Awards and Fundraising Ceremony, United for Equity. Thank you for joining us this evening as we honor and celebrate the luminaries and trailblazers making a difference in the field of aging. My name is Cindy Padilla, and I'm the chairwoman of NHCOA's Board of Directors. It is truly an honor to be a part of this celebration. And yes, here we are again, unable to hold our event in person, which has been our custom over the past years. We thank you for being with us in this virtual arena. Our theme this year is United for Equity, and NHCOA is grateful for all the contributions that have been made to advance equity, especially those made by individuals being recognized this year. And while we have made important progress, we know much more remains to be done in the areas of health, economic security, and housing. But we are strong and we are united. We stand united for equity to address systemic and structural barriers that are keeping many in our communities from aging well. We at the National Hispanic Council on Aging are working along with our partners to remove these barriers that prevent many people from aging in dignity and in the best possible health. As an organization, we know this is possible, but we also know that we must stand united to ensure this for our future and the future of older adults across this country. Over the years, many Hispanics and other minority populations have faced continuing disparities in the areas of housing, economic security, education, immigration, and access to health care. However, thanks to hard work, perseverance, and the courage of those who are being recognized tonight, today more than ever, Latino voices resonate in the struggle for a just, fair, and free country for all. It's true that the arrival of COVID-19 has further highlighted the consequences of health disparities. We have seen over the past 2 years, the continued disparity that exists in healthcare and access to healthcare, which is why now is the perfect time to demand a transformation of systems to create inclusive policies in all areas with particular emphasis on access to healthcare. The high vulnerability of the Hispanic population is a reflection of the need to continue creating spaces and supporting organizations that are working on reducing the current social gap among diverse populations. We remain committed to this work. NHCOA has worked for more than 50 years to improve the quality of life of the Hispanic older adult community their families, and caregivers through multiple efforts that ensure fair, dignifying, and discrimination-free aging. Our organization continues its work in the areas of public policy, research, and education so that we can strengthen the Hispanic community in all areas and therefore the older adult population. NHCOA continues to work tirelessly for older adults, their families, and caregivers to ensure access to needed resources, aging securely with dignity, greater self-sufficiency, and in the best possible health, value and honor for their lifelong contributions to their families and society, and a strong voice on issues of concern to them locally and nationally. We continue to advocate for the protection of valuable benefits such as housing, Social Security, Medicare, and Medicaid. We believe that access to health care must remain a priority, not only for those working in the field of aging, but for policymakers at all levels. United for Equity, NHCOA recognizes the responsibility of continuing to make a positive impact within communities, opening new paths that help build a more diverse, respectful country, focusing on improving living conditions for Hispanics and thereby ensuring healthy aging. And it must be done by all of us. We all must be united and committed to creating better health outcomes for all of our elders and future generations. Again, it is our sincere pleasure to celebrate and honor our awardees. And before ending my remarks, I would also like to thank all of our partners, our sponsors, and especially all of you for supporting our mission and work throughout the year. Gracias and welcome. We hope you enjoy our virtual awards ceremony. Thank you.
Now, let's enjoy a wonderful dance performance from Javier Buentello and Malia Norin.
No te atrevas a decir te quiero. No te atrevas a decir que fue todo un sueño. Una sola mirada me basta para matarme y mandarme al infierno.
Today, we honor individuals whose efforts promoted change to achieve dignity, safety, and the well-being of older adults. Let's start with the first presenter for this year's Outstanding Public Health Award. Welcome, Mr. Zachary Bastian, member of NHCOA's Business Advisory Council.
Good evening. My name is Zachary Bastian, Manager of Strategic Alliances with Verizon and a proud partner of the National Hispanic Council on Aging. Tonight, it's my honor to present this year's Outstanding Public Health Award. The recipient of the Outstanding Public Health Award goes to an individual who has demonstrated excellence, innovation, and a commitment to the health of Hispanic older adults. This year's recipient is Mark Elrick, County Executive for Montgomery County. He was formerly an at-large member of the Montgomery County Council, first elected in 2006. As County Council member, he was the chief sponsor of several landmark pieces of legislation and programs. He led the successful effort to increase the Montgomery County minimum wage in coordination with surrounding jurisdictions to $11.50 an hour, and subsequent legislation that will eventually increase the minimum wage to $15 an hour. He was the first elected official to propose building a bus rapid transit, or BRT, system throughout the county to address Montgomery County's transportation and environmental problems. Ground was broken in fall 2018 for the first BRT line, which will run along Route 29. Throughout his political career, he has been a champion of improving tenants' rights and for making developers pay a greater share of the infrastructure costs to build schools and transportation solutions. Montgomery County has performed among the best in the nation in dealing with the COVID-19 pandemic, doing it with a focus on equity. Currently, Montgomery County continues to have the highest vaccination rate in the country for all jurisdictions with more than 300,000 people, and also where the 65 and over population is now more than 95% fully vaccinated. Latinos enjoy one of the highest rates of vaccination in the county. Ladies and gentlemen, please acknowledge this year's Outstanding Public Health Award winner, Montgomery County Executive Mark Elrick.
Muchas gracias to the National Hispanic Council on Aging for this tremendous honor. Receiving the 2021 Outstanding Public Health Award is special because it's recognition of the hard work that we have put into keeping our residents safe. I share this honor with thousands of Montgomery County employees who continue to work tirelessly to keep our government running and keeping all of our communities as safe as possible. Throughout this pandemic, we've been committed to ensuring that every community within our borders receives information about COVID, as well as access to testing and vaccines. As Maryland's most diverse county, it is imperative that we communicate and provide services equitably. As a result, we've had the highest vaccination rate in the country among large counties, and our Latino community has vaccination rates that are equal to or even higher than the white community. I'm proud of these results because we've been laser focused on equity, and today over 80% of our residents across all races and ethnicities are fully vaccinated, and 99% of our 65 and older population is fully vaccinated. Parallel to these efforts has been the provision of other critical resources to stem food insecurity, help people keep a roof over their heads, and ensure businesses and organizations stay open and survive the impact of this pandemic. This has not just been a government effort, however. The people of Montgomery County have also stepped up to help and get vaccinated. Our success reflects our commitment to putting the health of our residents first by relying on science and data to make our decisions. It has not been easy, but the results speak for themselves. In fact, one of our most successful endeavors during the pandemic has been Por Nuestra Salud y Bienestar. Spearheaded by our Latino Health Initiative, this public-private partnership with preeminent Latino-serving organizations has been at the forefront of our COVID-19 pandemic response. An essential component of Por Nuestra Salud y Bienestar has been its communication strategy to leverage the powerful role the grandmothers, abuelas, play within the Latino family and community as a whole. This led to the creation of Abuelina, a digitally animated Salvadoran grandmother and her family. Abuelina has been such an effective spokesperson for our COVID health, safety, and vaccination messaging that she's won an Emmy Award and brought national and international media accolades to the county. We are now in the process of copywriting the Abuelina character, and her role will help us expand to other areas of public health, public safety, and county government information geared to the Latino community. Abuelina demonstrates the deliberate investment, thoughtful effort, and commitment to cultural competency and ethnic equity that my administration is dedicated to, not just in handling COVID, but through all of our governing practices. Once again, I want to thank the National Hispanic Council on Aging for recognizing this work. The award will have my name on it, but it should bear the names of the countless employees, health promoters, community partners, and volunteers who have put the residents of Montgomery County first to keep us all safe and healthy. I'm honored to accept this award on their behalf. Gracias.
The next award is the Entrepreneurship Recognition Award and will be presented by Irene Bueno, a member of NHCOA's Business Advisory Council.
Good evening, everyone. My name is Irene Bueno, and it is my honor to present this year's Entrepreneurship Recognition Award. The Entrepreneurship Award goes to the individual who has demonstrated excellence, innovation, and commitment to the well-being of society by creating employment and economic development opportunities, especially for women and older adults, and by upholding environmentally friendly practices. This includes both profit and nonprofit entities. This year's recipients are mother-daughter duo Stella and Alexa Bubon. When Stella and Alexa founded Babe Essentials in 2017, never did they think their company would grow to what it is today. Alexa stands behind the fact that the brain behind the formulations is purely Stella, who influenced her love and passion for clean, safe, and simple beauty. Being from Haiti, they were always surrounded by nature, land, and culture. Taking advantage of the island's pure, raw ingredients and in search of the perfect tan for the summer of 2017, Babe Essentials was born. They believe that using pure, natural, and timeless ingredients nature has to offer is a path to beautiful skin. They are strong believers that less is more. They like to keep it simple and enable everyone to get the long-term results they are looking for. They achieve this goal by emphasizing simple, raw, and natural skin care and beauty routine. Their goal is to be known for pure and high-quality products, alongside a strong focus on female empowerment and a dedication to the farmers who provide amazing raw ingredients. So, ladies and gentlemen, please acknowledge this year's Entrepreneurship Award winners, Stella and Alexa Bourbon.
Hi everyone, my name is Alexa Baboun and I am the co-founder of Babe Essential, who is today receiving the award for the entrepreneurship recognition. I am beyond touched, grateful, and honored to receive this award because as a whole, Babe Essentials is not just a company who wants to sell products, clean skincare, beauty, body care products. We actually aim to give back to our community, especially in Haiti, who is one of the poorest countries in the world, if not the poorest country in the world. And we aim at, trying to give back to the community, to the farmers who have local production, where we get our oils from, our raw materials, and essentially that is the core of the mission, is to really give back and support what our island can give to us. And apart from that, we are also only women owned. So my partner, my mother, she couldn't be here today to take this award with me, but we are both very honored. And at the store and manufacturing site, we are only women. And it means the world to me to be able to give back to these women who are giving their lives to their children, to their country, and who are so committed to making a change. So it is my honor to actually help them out the best way that I can, to give back to their communities, their kids, and also to provide jobs for them. I try my best to be able to teach them about what it is, what clean skincare, clean beauty is, and what they can do with these raw materials themselves. Haiti has so much to offer, and we are only recognized for what is bad and what is negative. And I think it's time to kind of switch the perspective. So apart from being women owned, we are fully fabricated and manufactured in Haiti, which is something that is very, very important to me. My country has so much to offer, and I think it is my responsibility to show the world what we can, offer in terms of beauty and work and labor and all sorts of really different things. The list goes on. But today I am receiving this entrepreneurship award with a really open heart, and it really means the world to me that I was chosen because of the background of Babe Essentials. So my mom and I started this in 2017, and it was purely a hobby, and now we are growing it to become something that is hopefully going to be globally known. We have big plans for the future, and we are honored to share that with you. So please follow us on Instagram and social media, and visit our website at babeessentials.com to learn more about our new products and the different types of products we do offer. But thank you so much. It is an honor, and happy holidays.
And the long-awaited moment has come. It's time to start our exciting giveaway. The rules are simple. In order to enter, you have to do just one thing. Leave a comment in the chat box answering this important question. What does equality mean to you? And please use the hashtag NHCOA Awards 21. There's only one entry per account. Once you comment, you will automatically be participating to win the Apple Watch. How exciting. Remember, there are no wrong answers. We just want to know your opinion. The winner will randomly be picked through an online generator. And that lucky winner will be announced tomorrow on all of our social media platforms. So please stay tuned to our Facebook, Instagram, and Twitter pages for the official announcement. If you are the lucky one to win, we will be contacting you directly through Facebook Messenger. So leave your comment in the chat box and be part of this amazing, exciting giveaway. Best of luck to everyone, and thank you so much for being here with us tonight, celebrating equality. Let's continue with our next presenter, Winta Menges, who's the Senior Manager of Federal and State Outreach and Health Equity Alliance Development from Amgen. Today, Ms. Menges will present the Ophelia Rinaldi Recognition Award.
I'm Winta Menges, Senior Manager of Government Affairs and Health Equity at Amgen. It's my honor to present NHCOA's Ophelia Rinaldi Recognition Award. At Amgen, our mission is to serve patients, and our vision is for a future in which all Americans enjoy health equity regardless of race, ethnicity, age, or other socioeconomic factors. Now, for more than 40 years, Amgen's commitment to science and innovation has helped patients live longer and healthier lives. We believe that health is truly equal when everyone everywhere has a fair and just opportunity to be as healthy as possible. The Ofelia Rinaldi Recognition Award goes to an individual who has demonstrated a lifetime commitment to improving the lives of older adults, with a special focus on the mental health of the Hispanic population. This year's recipient is Fabiola Moran, Data Entry and Delivery Coordinator at Vida Senior Centers. Ms. Moran was born and raised in Lima, Peru. She currently resides in Warrenton, Virginia on the Peruvian Paso Horse Ranch. She's a wife, mother of 2, and a grandmother. Ms. Moran is a teacher with a degree in special education, as well as the Montessori method of education. For several years, she has been a very active cultural promoter and a leader in her community in Washington, D.C. Currently, Fabiola is part of the Vida Senior Center team, an organization that helps the elder community in Washington, D.C. Since the beginning of the pandemic, Fabiola had dedicated her time to providing fresh produce on a weekly basis to the houses of the elder members of Vida Senior Center. Because of her community outreach, the D.C. Mayor's Office on Latino Affairs awarded Ms. Moran the Somos 2020 Award for Public Safety. Ladies and gentlemen, please acknowledge this year's Ofelia Rinaldi Recognition Award winner, Ms. Fabiola Moran.
¿Cómo están? Mi nombre es Fabiola Morán, soy de Perú y soy parte del team de Vida Senior Center. Estoy muy agradecida con NHCOA por este lindo reconocimiento ante mi trabajo. De verdad que me alegro mucho que hayan pensado en mí. Me sorprendió mucho el recibir el email, pero de verdad que eso me ayuda a seguirme esforzando y trabajando más en pro del adulto mayor en Washington, D.C. Mi trabajo a raíz de la pandemia cambió, pero cambió para bien, para conocer más a los señores. Antes trabajaba en un escritorio, sentada, metiendo data, ayudando en las clases y todo, pero a raíz de la pandemia tuvimos que salir a atender a los señores, llevándoles alimentación cada semana, porque me acuerdo mucho, desde el 15 de marzo hasta la fecha no hemos parado de ayudarlos. Y comenzamos gracias al apoyo, porque esto ha sido un trabajo en conjunto con la ciudad, especialmente con la Oficina de Asuntos Latinos, con la señora Jackie Reyes, que nos ayudó mucho, a enviarles comida cada semana, todos los miércoles específicamente, llevándole a sus casas, porque ellos no podían salir. Entonces me convertí en un nexo, en un enlace comunitario, para saber si las personas necesitaban medicamentos, si estaban enfermos, si algo les faltaba. Entonces yo daba informes a mi trabajo y tratábamos de ayudar. Igual la ciudad siempre nos ha apoyado con mascarillas, gel, sanitizer, todas esas cosas para poder dar a los señores. También nos dedicamos a través de con Vida y la ciudad para podernos comunicar. Se les donó tablet para poderlos ayudar y nos podamos comunicar virtualmente con los señores. Pero fue muy bonito porque las personas comenzaron a entender la importancia que es ayudarnos y estar todos comprometidos en una sola, en que el adulto mayor no quede desamparado. Y así seguimos. Yo voy cada miércoles a llevar a Casa Iris sus comidas. Tratamos de buscar y es un trabajo a veces en equipo, porque a veces no se puede movilizarnos y yo sola me movilizo con mi camioneta. Mi esposo es parte también voluntario porque me ofrece su movilidad y con eso a veces no puedo, pero todos nos ayudamos. Va Pedro a ayudarme a recoger la comida, pero que no falte ni una semana un vegetal fresco para los señores. De verdad que me gustaría que más personas se integraran, nos ayudaran a conseguir más, porque no solo somos un grupito de 400 personas que están registradas, somos muchos más, pero necesitamos ayuda para que en fiestas, en actividades, en fechas memorables como Thanksgiving, Navidad, no les falte ni un plato de comida a los señores. Vamos a llegar a viejos y tenemos que apoyarnos, y yo quisiera que cuando yo llegue a ser viejita, alguien me lleve un plato de comida, un vegetal o algo, para que eso, enseñar a nuestros hijos, nietos, amigos, que nosotros también, ese es nuestro futuro y que vamos a llegarlo ahí, que todos nos tenemos que, para estar mejor, ayudarnos. Gracias por esto. Este premio lo comparto, que es Ofelia Rinaldi, el reconocimiento con todos los señores, porque han sido parte de mi vida, han sido parte de como mi familia. Ellos han hecho de que cuidarme, me han cuidado y yo los he cuidado para no enfermarnos y que cada semana les llegue su alimento. Muchas gracias a todos, al equipo de NHCOA, a mis compañeros de trabajo de Vida Senior Center, a la ciudad, a la Oficina de Asuntos Latinos, a amistades, ¿no?, que todos nos han ayudado a dar, a la organización de la Dr. Roach, que cada semana igual también me dan vegetales, y a todos, amigos y amistades que siempre están colaborando, que cuando yo pido alguna ayuda, siempre dicen presente y me ayudan con un alimento para un adulto mayor. Muchas gracias y que Dios les bendiga.
Let's welcome our next presenter, Michelle Kimbrough, a member of NHCOA's Board of Directors. Today, Ms. Kimbrough will present the President's Award. Welcome, Ms. Kimbrough.
Ladies and gentlemen, my name is Michelle Kimbrough, Director of Federal Advocacy at Eli Lilly & Company, and a proud member of NHCOA's Business Advisory Council. It is my honor to present this year's President's Award. The recipient of the President's Award goes to an individual who has shown a strong commitment to supporting policy and programs aimed at ensuring older adults and their caregivers of all backgrounds get a fair chance of succeeding in this world. This year's recipient is Dr. Janet Miltenius, founder and president of the Salvadorian Cultural Institute, or Casa de la Cultura El Salvador. A nonprofit organization based in Washington, D.C., the Salvadoran Cultural Institute is dedicated to educating, promoting, and celebrating Salvadoran and Salvadoran American arts, culture, and history. They support other organizations interested in reaching the Salvadoran and/or Latino community with important art, language, and cultural events. Dr. Miltenius has expertise in tobacco, alcohol, food, and active living policy development, community mobilization, and policy implementation, as well as media advocacy. She served as executive director of the National Latino Council on Alcohol and Tobacco Prevention, building leadership and capacity nationwide in support of policy changes. She is also well known internationally for her work on human resources for health, environment health, and HIV/AIDS care and prevention. She provides technical assistance and training in Latin America and the Caribbean as a consultant for the Pan American Health Organization and World Health Organization. Dr. Miltenius is an immigrant from El Salvador, has a master's in counseling psychology from Antioch College, a master's in economics, and a doctorate in social sciences from the Institute for Social and Economic Development in Paris. Ladies and gentlemen, please acknowledge this year's President's Award winner, Dr. Janet Miltenius.
Good evening, everyone. My name is Janet Miltenius, and I'm joining you this evening from Mexico, where I'm visiting my mother. I want to let you know how honored I am to receive this award from the National Hispanic Council on Aging. I think that the work that you all do is marvelous, and I am really thrilled to receive this award. Thank you very much, and I wish you a delightful evening. Buenas noches, queridos amigos, agradeciéndole mucho al National Hispanic Council on Aging por darme este reconocimiento en nombre de la Casa de la Cultura El Salvador, que nosotros somos de un grupo de voluntarios dedicados a celebrar, conocer y promover la cultura salvadoreña y las artes, porque para todos la identidad latina es muy importante y por eso es lo que nos hace seguir adelante, vivir y gozar de nuestra cultura y de nuestra lengua. Muchísimas gracias de nuevo por ese magnífico reconocimiento y que se diviertan. Gracias.
Our next presenter is Mr. Jorge Lambrinos, a member of NHCOA's Board of Directors. Mr. Lambrinos will present the Outstanding Community Service Award.
Good evening. My name is Jorge Lambrinos, and it is my pleasure and honor to present the Outstanding Community Service Award to a most deserving individual. The recipient of the Outstanding Community Service Award is an individual who has demonstrated excellence, innovation, and commitment to the well-being of Hispanic older adults. This year's recipient is Jessica Maria Mendoza Barquin, Consul General of Guatemala in Washington, D.C. Jessica studied international relations at the University of Francisco Marroquin in Guatemala City and was appointed in November 2017 as the Consul General of Guatemala. She has been working for the Ministry of Foreign Affairs of Guatemala for more than 20 years, both at its headquarters and in various consular missions abroad. Prior to her assignment in Maryland, she was the Vice Consul of Guatemala in Miami, Florida, and from 2008 to 2016, she was the Vice Consul of Guatemala in Phoenix, Arizona, where her main responsibilities was her consular protection for Guatemalan citizens in vulnerable conditions. While she was on duty in Phoenix, she guided the Guatemalan community to organize and developed activities in benefit of the immigrant community there. In Washington, she has partnered with organizations like the National Hispanic Council on Aging to benefit older adults and Latino families. Jessica has demonstrated a commitment to protecting older adults and vulnerable populations through nutritional and cultural activities. For example, she delivers meals regularly to our older adults at Casa Iris and believes in offering meals that are culturally appropriate. The meals are usually accompanied by music, a dance, or some type of cultural component. Her presence brightens the day of nuestros abuelitos and brings back pleasant memories. The older adults love Jessica and how she brings joy to their days. She normally goes apartment to apartment, asking every individual how they are doing and if they are happy. Her care, her warmth means a lot to older adults. Ladies and gentlemen, please acknowledge this year's Outstanding Community Service Award winner, Consul General Jessica Maria Mendoza Barquin.
Muchas gracias por este reconocimiento. Es un reconocimiento que me complace recibir y el cual refleja que cuando nos unimos como comunidad migrante en este país podemos hacer grandes cosas. Agradezco a la doctora Yanira Cruz por la oportunidad que nos ha dado al abrirnos las puertas de NHCOA y poder extender nuestra asistencia a la comunidad de la tercera edad, quienes son los más vulnerables y muchas veces necesitan no solo artículos como alimentación y vestuario, sino también un poco de atención y afecto. A pesar de la pandemia que hemos vivido a lo largo de los últimos meses, logramos realizar una actividad en conjunto con otras organizaciones lideradas por guatemaltecos y hermanos centroamericanos que acudieron a mi llamado para unir esfuerzos y llevarle un poco de convivencia y alegría a los habitantes de Casa Iris, quienes por muchos meses tuvieron que estar aislados por su protección debido a la pandemia COVID-19. Así que este reconocimiento también es extendido a todas aquellas personas que me han apoyado y que espero me sigan apoyando para llevar a cabo futuras actividades. Exhorto a NHCOA a no bajar la guardia y seguir buscando esos espacios que permitan continuar la asistencia humanitaria de Casa Iris y sus habitantes. Muchas gracias.
Let's continue with our next round of awards. Our next presenter is Alex Perilla, a member of NHCOA's Board of Directors. Today, Mr. Perilla will present the Research Recognition Award.
Greetings from a beautiful fall day in Phoenix, Arizona. My name is Alejandro Perilla, and I'm a member of NHCOA's Board of Directors. It is my honor to present this year's Research Recognition Award. The recipient of the Research Recognition Award goes to an individual who has demonstrated a commitment to improving the health of diverse populations through research. This year's recipient is Dr. Adriana Perez, an assistant professor and senior fellow at the Leonard Davis Institute of Health Economics at the University of Pennsylvania School of Nursing. She has served in various leadership roles locally and nationally to advance health equity among Latinos and other historically marginalized communities. Dr. Perez served as a policy advisor of the National Association of Hispanic Nurses. She is a member of the Public Policy Committee at the Gerontological Society of America. She served as a Congressional Health and Aging Policy Fellow, supported by the Atlantic Philanthropies and CDC's Healthy Aging Program. Dr. Perez also leads a transdisciplinary program of research funded by NIH and focused on the influence of multi-level factors on physical activity, cognitive health, cardiovascular health, and sleep among Spanish-speaking older adults with Alzheimer's disease and other related dementias. She is a scientist at the Center for Improving Care Delivery for the Aging, at Penn's Resource Center for Minority Aging, and she maintains her practice as a board-certified adult nurse practitioner, providing community-based long-term care for diverse, frail elders who reside in North Philadelphia. So, on behalf of NHCOA's Board of Directors and on behalf of all Sun Devils here at Arizona State University, congratulations, Dr. Perez, for receiving this year's Research Recognition Award.
Thank you, National Hispanic Council on Aging and Doctora Yanira Cruz. As a nurse scientist, I am deeply committed to making research more inclusive of older Hispanics and Latinos and to contribute to a scientific workforce that reflects our community. Although the population experiences a disproportionate burden of many chronic conditions such as Alzheimer's disease, less than 5% of Alzheimer's clinical trials include Hispanics. I look forward to making a difference in this by working with community partners, other scientists, older Hispanics and Latinos, and their families to advance cognitive health equity. I'm deeply honored to receive this Research Recognition Award from NHCOA, a leading organization dedicated to promoting, educating, advocating for research policy and practice that ensures Hispanics and Latinos can live long and healthy lives. And Doctora Yanira Cruz, thank you for being an exemplary leader in this work, and I join you in your important mission. Thank you.
I hope you're enjoying today's event. We have enjoyed salsa and merengue performances, as well as beautiful music that has surely made all of you dance in your homes. It certainly is making me dance right here in my seat. I want to introduce Maury Pierce Smile, Vice President of the Office of Community Engagement at AARP, who will present the Caregiving AARP Service Award.
Greetings, I'm Maury Smile, Vice President for AARP's Office of Community Engagement. AARP is proud to sponsor this year's National Hispanic Council on Aging Award ceremony, where we recognize individuals making a huge difference in the lives of Hispanic older adults. I have the honor of presenting the 2021 Caregiving AARP Service Award to Alvaro Obregon. Alvaro has made an impact in Chicagoland and nationally, bringing AARP's commitment to providing caregiving resources to life in both English and Spanish. AARP's founder, Dr. Ethel Percy Andrus, had a motto that Alvaro personifies: what we do for all. Alvaro's professional career and personal life have always been in service of individuals 50 or older, whether in government, in community, and for the last 5 years at AARP, he is a trailblazer in the association, providing dynamic programming to a monolingual and bilingual audience. He sets the bar, and he sets it high. In 2 minutes, I can't do Alvaro's professional vita justice, but I can share that his supersuit isn't worn just during business hours. Alvaro walks the walk and talks the talk. He is also a caregiver for his mother, who just turned 90, and his 83-year-old uncle, while also helping another 92-year-old uncle. Alvaro brings our founder's words to life daily, on the job, in his numerous philanthropic endeavors, and personally. For these reasons and more, Alvaro, I am pleased to present you with the 2021 Caregiving AARP Service Award. Congratulations.
Buenas tardes y muchísimas gracias. Es un honor recibir este reconocimiento de servicio para cuidadores del Consejo Nacional Hispano para el Adulto Mayor y AARP. Thank you so much. I am so deeply honored to receive this Caregiving AARP Service Award today from the National Hispanic Council on Aging. I never knew I was a caregiver or that there was even a word for it, un cuidador. As a Mexicano, and seeing my mom and tia take care of my grandparents, I knew that taking care of our loved ones was not just a responsibility, but an honor. Having lost my dad at the tender age of 3 years old, my mom was more than a strong woman. She was Superwoman. She was and continues to be my hero. But seeing her age has been difficult. She can no longer do those Superwoman things that she once could do so easily for herself. While caring for my mom, her youngest sibling, my tia Nena, may she rest in peace, was diagnosed with leukemia. I suddenly found myself caring for not just one, but 3 people, mi mamá, mi tío, y mi tía, while trying to juggle work and personal life. It was at AARP where I learned that I was a caregiver and that I was not alone. Taking those lessons that my mom demonstrated day in and day out for all those around her has been the single most important lesson that I learned in life: to give everything of yourself in service to others. All of that has led me to work tirelessly for the Hispanic Latino community, mi comunidad. I'm proud of the work that we have done because I know that no matter how much we can each do individually, we can do so much more as a collective, juntos. And what we do must not just be successful, it must be replicable so that we can learn from each other and serve everyone. Taking care of my mom and her siblings, my tío and tía, has been a real honor. Although very challenging at times, I wouldn't trade a single minute of this labor of love in order to serve and take care of them. Being a caregiver means that you often put others before you. It means that when you're invited somewhere, you can't give a yes or a no. It means that sometimes quizás, perhaps, or depende, it depends, is the only honest answer you can give. Being a caregiver means that sometimes you feel the weight of the world on your shoulders and you cry yourself to sleep at night. And being a caregiver also means that immense sense of amor y tradición, love and tradition. It gives you the energy to get up and, like Don Quixote, do it all over again. Our loved ones, like my mom, showed us through their example that they are superheroes. But I want all of those family caregivers to know that to our loved ones, you too are superheroes. For all of those family caregivers, esos cuidadores, but most especially to my mom, Felicitas Obregón, who just turned 90. You showed me how to love, and in doing so, you also showed me how to truly live. Para ti, mamá, tú me enseñaste a amar con todo, y al enseñarme eso también, me enseñaste a vivir. Te quiero mucho, muchísimo. Mil gracias.
Lastly, let's welcome our final presenter, Bob Blancato, also a member of NHCOA's Board of Directors. Today, Mr. Blancato will present the Outstanding Public Policy Award.
Good evening. My name is Bob Blancato, and it's my honor to present this year's Outstanding Public Policy Award. The recipient of the Outstanding Public Policy Award is an individual who has demonstrated a commitment to advocating for public policy that benefits diverse aging populations. This year's recipient is Senator Amy Klobuchar. Senator Klobuchar is the first woman elected to represent the state of Minnesota in the United States Senate and has built a reputation of putting partisanship aside to help strengthen the economy, support families, workers, and businesses. Since arriving in the Senate, Senator Klobuchar has worked with Democrats and Republicans to get things done. She led the effort to pass landmark pieces of legislation to end human trafficking and combat the opioid epidemic. She fought to pass the most significant consumer product safety legislation in a generation, keeping foreign toxic products off our shores and out of our stores, and pushed cell phone companies to enact more consumer-friendly policies. As a member of the Joint Economic Committee and the Senate Commerce Committee, Senator Klobuchar has been a leader in working to implement a competitive agenda to ensure businesses have the tools they need to grow and create good jobs in their communities and support them during the pandemic. Senator Klobuchar also serves as the chairwoman on the Judiciary Subcommittee on Competition, Policy, Antitrust, and Consumer Rights, where she has worked to reinvigorate America's antitrust laws and restore competition to American markets. In her role on the Judiciary Committee, she has been active in advocating for legislation focused on civil rights, criminal justice, immigration reform, and guardianship reform. Ladies and gentlemen, please acknowledge this year's Outstanding Public Policy Award winner, Senator Klobuchar.
Hello, everyone, and thank you, Robert, for that kind introduction, and to everyone at the National Hispanic Council on Aging for presenting me with this award. I can't tell you how much it means to me. Our Hispanic community in Minnesota has been such a bright, shining light for our state. People who have been there for a long time and have really paved the way, started businesses, been major forces in our economy, in our government, as well as the new members who are joining them now. And it's been my honor to work with your community in Minnesota as well as nationally. You know I'm never going to give up till we get immigration reform passed, but today I wanted to focus on something else. And that is what your organization, for more than 50 years, has done to improve the lives of Hispanic older adults, their families, and their caregivers. From research to education to advocacy, everything you do empowers people to age with dignity. A lot of times people can't go to Congress themselves, especially some of our seniors, and they need you. They need you being there and being their voice. It's an incredible mission of your organization, and I'm proud to be your partner in making it a reality. Since the theme of today's ceremony is United for Equality, I'd like to talk about 3 issues I'm focused on to make sure our healthcare system is more equitable, that it works for everyone. They are, first of all, supporting caregivers, secondly, lowering the cost of prescription drugs, and third, encouraging and expanding access to preventative care. I know how important but challenging it can be to take care of an aging relative. I know how hard it can be on the person, especially during this time of pandemic, where we put a big magnifying glass on our issues of not having enough caretakers or not being able to access the kind of help that we need. We lost my dad this year. He had Alzheimer's, and I saw firsthand what a gift it is to be able to see your loved ones. For him, he got more sick the last few months after the vaccine, so I finally was able to go see him in person. But I'll never forget standing through that glass when he actually got COVID, thinking we were going to lose him, not being able to give him a hug. He ended up making it through COVID, and then we lost him about a year later. But it really made me think a lot about the importance of caretaking. And in my dad's case, it was a long goodbye as his memory was going. But you should know he still was smiling to the end. He was educating all the caregivers on new words because he was a journalist and had all kinds of ideas to the very end. And we miss him, but I love him so much. One of the reasons that I want to make sure that the Build Back Better Act make sure that we continue to lower the cost of home and community-based caregiving services is because of my dad. I think for a while more he would have liked to stay at home, but it was really hard to work that out. And what our bill does is it includes specific provisions for older Americans with the greatest social need, like people of color, people who live far away from the nearest hospital or clinic. It also includes investments in both training family caregivers and giving them the help they need, because we know they do some of the hardest work out there. And there's so many people in the sandwich generation. They're in the middle. They're taking care of their own kids, and they're also wanting to make sure that there is great care for their parents. I'm also leading legislation to create a tax credit for the cost of caring for an aging relative. This legislation will bring some relief to many families and caregivers who support older Americans. Second thing, we need to bring down the cost of prescription drugs. This couldn't be more urgent. Prescription drug prices in the U.S. are more than 250% of those in other industrialized countries. In the past 5 years, the cost of Lyrica and Symbicort, common drugs, one for nerve pain, one for asthma, have increased almost 50%. In many cases, Americans pay the highest prices in the world, for the same drugs that they can get elsewhere for cheaper. The results are dire. Nearly 20% of older adults have reported not taking their medicines as prescribed because of cost. I literally met a woman who saves the insulin, the drops of insulin in the vial from day to day. Too many older adults are being crushed by the weight of their drug prices. They feel it when the cost of their prescription doubles, when they have to choose whether to refill their meds or pay their electric bill, when they stretch their medication supply by skipping doses and rationing pills, risking their health. That's why I fought so hard to make sure we have Medicare negotiation, just like the VA has, to bring down the cost of drugs. That is in Build Back Better. It's not everything I wanted. I would have gone just like the VA. But we have an incredible start at this, where we'll start negotiating right away, and we will get some lower prices for all of you. Also, our legislation will cap the cost of insulin at $35 per month, stop price gouging of prescription drugs. It also will have an inflation cap, and it's going to reduce out-of-pocket drug spending for millions of older adults. Finally, I want to talk about preventative care, an issue that became even more personal for me recently. Earlier this year, because of a routine mammogram, I learned that I had stage 1A breast cancer. Thanks to my incredible Minnesota doctors and nurses, treatment went well, and my doctors believe that my chances of developing cancer again are no greater than the average person. I know that if I hadn't gotten that screening, it very well could have advanced and become something much more deadly, but it didn't. That's the power of preventative care. With a lumpectomy and radiation, I was able to come out of it strong. With so many Americans, including older Americans, behind on their regular checkups as a result of the pandemic, so many communities, immigrant communities, including the Hispanic community, behind on their regular checkups, it's clear we need to take action to make sure that they have the resources and the information they need to access this potentially life-saving care. That's why I recently introduced the Bipartisan Preventative Care Awareness Act to promote screenings and preventative care while addressing disparities in these services. We know the kind of disparities we saw early on in COVID with the death rates, with the difficulty of getting vaccines to the Hispanic population. We have been moving and working on that every single day. In fact, Ben Ray Lujan and I, Senator Lujan and I, have a bill to stop the misinformation about vaccines to the Hispanic community. And we sent a letter to the head of Facebook about that because we found out they weren't informing people like they should about vaccines. All of that goes into the same thing. It's about making sure the Hispanic community, and particularly the older Hispanic community, is able to get the care that they need, not just for COVID, but for all preventative care. I want to thank you one more time for honoring me with this award. Working together, I know we can make a difference in the lives of so many Hispanic older adults, caregivers, and families. Enjoy the rest of the ceremony. Here's a toast to you. I've got coffee. It's cold right now in Washington. Thank you for what you do.
Before presenting our next portion of the ceremony, we'd like to listen to some Brazilian jazz with Douglas Lira Band for one more music performance. It is now my pleasure to introduce the fundraising session of our evening. Let's welcome Mrs. Cindy Padilla, Chairwoman of NHCOA's Board of Directors, who will moderate this portion.
Hello again, and thank you, Maria, for being with us this evening and hosting our event. And thank you all for staying with us. This has been an exciting evening, and again, I want to congratulate and thank all of our awardees for their commitment and tireless work supporting healthy aging of our older Hispanic adults. It is truly my pleasure to moderate the funding raising portion of our evening. We know that we must work united for equity, equality, and dignity for all older adults. And yes, we also know that this work takes funding. We are fortunate that much of our programmatic work is supported by grants, but much of our work is also sustained by sponsorships and individual donors like you. For NHCOA, our highest priority is to create a space where we can all age in safety, good health, and with dignity. While addressing the many challenges brought on by the pandemic, NHCOA has pivoted to meet the needs of the communities we serve. We are forging new partnerships with different organizations, policymakers, and companies to help address the needs of Hispanic older adults. Many Hispanic older adults in the United States live in precarious conditions due to the health disparities, the economic problems, and the lack of access to decent housing. These factors lead them to extreme vulnerability, aggravated by the current health crisis. During the past 2 years, COVID-19 has dramatically impacted Hispanic communities. For example, Hispanics are 1.7 times more likely to contract COVID-19 than their non-Hispanic white counterparts, 4.1 times more likely to be hospitalized from COVID-19, and 2.8 times more likely to die from COVID-19. Due to the pandemic and its preventative requirements, NHCOA had to develop new ways to stay active. One solution was the development of a series of virtual events. Since the beginning of the pandemic, NHCOA has hosted over 20 virtual events and has partnered with other organizations to reach our communities in and out of the U.S. Our work has informed and educated our audience on pressing topics about COVID-19, its vaccines, its impact on mental health, aging, caregiving, and many other topics. Today, more than ever, Hispanic older adults need your support. We invite each one of you to join us and help us raise funds that directly impact NHCOA's ability to continue our programming, providing educational information to our community and to all of those who need it. We aim to impact thousands of Hispanic older adults, their families, and caregivers nationwide through our public health programs. And today, you can be a part of this effort. So how can you help us achieve our goal? Well, it's easy. First, you can donate to NHCOA. Every dollar you donate makes a huge difference, and you can make these donations of any amount at donatenow.networkforgood.org/NHCOA. Or you can text NHCOA 2021 at the following number, 202-883-3864, and donate. You can take photos demonstrating how you are sharing your best and then post them on Facebook or Twitter or Instagram using hashtag NHCOA, hashtag sharing the best of us, so others can be inspired by you. And last but surely not least, remember to always do something kind for another person. Every little action can change the world. I want to provide a little more information about how your donations can impact our work and the Hispanic older adults we serve. From its inception, NHCOA's activities have reflected our philosophy of empowering Hispanic older adults to advocate for the resources and services that they need and have the right to receive. An illustration of our work includes our virtual campaigns shared on our social media and website that inform our audiences on topics of major interest, such as HIV, which is still so very relevant. Through the Let's Stop HIV Together campaign, we continuously address HIV-related issues, especially when it's estimated that 65% of all people living with HIV will be over 50 in the next few years. Other examples of our work are the virtual campaigns created to prevent tobacco use, combat misinformation about COVID-19 and the flu, and empower the Latino population through influential figures within our community. All of these initiatives were created to inform, empower, and provide help through our digital media and adapting our work to what the current situation demands. And we also continue to work directly with our community following public health guidelines to prevent COVID-19 among the staff and our community. We ask for your support in continuing this effort. You can make donations of any amount at donatenow.networkforgood.org/NHCOA. That's /NHCOA. Our work also reaches other fields such as research. We recently held a series of focus groups across the country. We listened and we were able to identify and understand the condition of Latino families amid the COVID-19 pandemic. As of the voice of those we heard, we were able to provide a framework of solutions to improve the lives of our community through our Capitol Hill briefing. We provided detailed information in the NHCOA's 2021 Status of Hispanic Older Adults, which is available for everyone at our website.
What a wonderful evening. We're so fortunate to be celebrating and recognizing individuals whose legacy and work improves the lives of older adults, including Hispanic American older adults. On behalf of NHCOA, congratulations to all of this evening's awardees. We urge everyone joining us tonight to continue to advocate and empower your communities. Together, we are stronger. Now, before moving on to the next section of today's award ceremony, I'd like to present a video about NHCOA's important work and 50-year commitment to improving the lives of Hispanic older adults, their families, and caregivers. Let's enjoy it.
The National Hispanic Council on Aging is a national nonprofit organization that works to improve the lives of Hispanic older adults, their families, and caregivers. Health is one of our priorities. Economic security is a second priority. Housing is another big challenge for many older adults. We're fortunate to have 2 housing facilities, one here in DC and a second one in Kansas. I cannot underscore enough the importance of having more places for older adults where they're able to live with dignity and independently. If we have a roof over our heads, we are able to take care of all the other essential necessities that keep us going each day, like getting access to health services, access to our medication, having healthy meals each day, and just being able to function and have a healthy mind. Services that we're offering at the housing facilities are things like the social connector. The social connector is essentially a service that helps older adults navigate the system so that they find services that they want in their city. So for example, if they wanted to access support for mental health, we would help them to identify the support they need. The other service I'm very proud of that's being offered, especially during the pandemic, one of the things we heard from older adults is the levels of isolation. And so we have been offering group sessions that focus on mental health. We'll gather a group of residents who are interested in getting support for their mental health issues that they're experiencing. And we have psychologists work some of those issues collectively as a group. And we do it in the language that they prefer. So we do it in Spanish or we do it in English.
We also work on public policy, working with legislators in the policy-making process to educate and provide information on issues impacting Latinos, essentially providing the Hispanic perspective on issues as policy is being developed. We are often asked to testify in Congress on issues such as Social Security or healthcare or the Older Americans Act. Public health interventions are also an important component of our work. We are currently working on interventions at the local level in key areas around the country, impacting HIV prevention, COVID-19 vaccination, adult vaccination, as well as diabetes and Alzheimer's disease. We're also conducting research to gain understanding on key issues impacting Latinos. Right now, we're conducting research in areas including asthma, obesity, and also around COVID-19 and the impact it has had on Latino families. We're also working to increase awareness on the importance of participating in research and clinical trials, and for more Latinos and more Black and Brown communities to take part of the research process in our society, so that medicine and interventions that get developed actually take into account our genetic makeup and our realities.
Before ending tonight's program, I would like to once again give thanks, gracias, to NHCOA's sponsors. Also, thank you to NHCOA staff, our presenters, awardees, dancers, musicians, and of course, all of you for your ongoing dedication to older adults and for your incredible contributions to today's fundraising session. Our work continues every day, amigos, and together, juntos, we will be stronger. Let's continue advocating for programs and resources to better support older adults and their caregivers. Together, juntos, we can make their golden years ones of joy, peace, happiness, surrounded by those they love. Muchas gracias.